Coming up today on Good Things Utah, you may be pregnant, but that's no excuse to skip the workouts. Learn what exercises you can do while you're pregnant and what to avoid. And
Good Things Utah. Good Things Utah. Where the good things are.
Okay, everyone out there, if you are pregnant, you need to be exercising. And we've got Melanie Longmore here with LDS Hospital telling you what you should be doing to exercise and the best things to be doing. So thanks for being here, Melanie.
You bet.
Okay, so I loved one of the tips you were telling me before is if you haven't been doing certain things, now's not a time to be picking it up in pregnancy.
Definitely. If you try to start something new while you're pregnant, you're at more of a risk for falling, hurting yourself, hurting the baby. Your joints are actually a little bit looser when you're pregnant, and so again, you stand a risk of falling and hurting yourself. So
don't start something new, but what are some of the benefits of exercising throughout your pregnancy?
There are so many. One of them, or a few of them, are building up your stamina, boosting your energy levels, which who doesn't need that, helping you to sleep better at night, helping with back pain, helping to minimize the amount of weight that you gain. So you want to be careful with that.
Well, I had my first pregnancy, I didn't exercise the whole time, and I feel like that maybe is that more common? You see first-time moms more nervous about exercising?
It runs the gamut, and I think the important thing is to talk to your doctor and just let them know that you're interested in exercising, or should I be exercising? They can give you some specific guidelines, but being in shape when you deliver a baby, when you go into labor, it really helps you to have a better experience laboring. It also decreases your risk for a C-section.
Oh.
So
I feel like my best labor and pregnancy was the pregnancy that I did exercise through. So let's talk about the best exercises to do while you're pregnant.
Okay, there's a few. I would say walking is something that you could do that's low impact, and you don't have a real high risk of doing anything that could injure you or the baby. It gets your heart rate up enough if you're walking fast enough that it, gets your cardiovascular system pumping. Yoga is really good, and some different gyms have different yoga for pregnancy.
Oh,
so that's
wow,
something.
a different, well, we were talking earlier, and I would say, as those ligaments do change while you're pregnant, being able to be more limber will help with labor and delivery even.
Absolutely, it's really critical.
What about low impact aerobics? We saw this video earlier of this woman running, hugely pregnant. I would think aerobics should kind of be jumping around, moving around. How does that work when you're pregnant?
So again, you want to consult with your doctor, but I would say you don't want to use, if you're doing step aerobics, for example, you don't want to put your step on a really high platform because you're standing that risk of falling on your belly. So, but if you've done step aerobics before you were pregnant, I would say just be cautious about how high you make the step, and but it's okay to do.
What about swimming? What about swimming? I would think being weightless in the water when you're feeling not very weightless would be a good thing, and not putting pressure on your body. Yes,
swimming is another great one because you don't have that risk of impact, and feeling that weightlessness would probably feel good at that point. So it's definitely a good exercise.
What about, okay, you also talk about being on a bike, but that's both low impact and great for beginners. Why is that a great choice for beginners?
Right. Again, it's something that's fairly simple to do. If you've ridden a bike before, you know what to do. A stationary bike, again, is probably better than going outside and riding a bike on the street. But riding that stationary bike, you don't stand the risk of the impact. So.
Well, and we were talking earlier with cute Jenny, who comes with you and is pregnant, and she was talking about, she's a skier, and talking about, oh, should I ski while I'm pregnant? But we were saying, even normal activities like that, if you are a great skier, you have to be careful of the people around you.
That's
so
exactly
that's something I would think of with biking outside. Even if you feel confident biking, you can't control the outside forces.
Exactly.
Okay, so if someone is exercising when they're pregnant, what would be warning signs or something to tell them to stop, or that might not be the right activity for them?
I would say any sort of vaginal bleeding is something that you need to watch for. Any pain that doesn't go away or isn't alleviated by Tylenol, that might be something that you want to talk to the doctor about. Contracting. You want to make sure that you're really staying hydrated when you're exercising. That's something, if you're dehydrated, it can actually cause contractions. So make sure that you're drinking water, that you're warming up, and that you're cooling down. when you're pregnant. So
thank you so much, Melanie, for all of those great tips. And we're going to have more tips for you guys available on the LDS Hospital website. The link is from our website. And when we come back